Well, hey everybody, it's Sandy, and welcome back to my channel dedicated to helping you become your advocate for your own health, one topic at a time. First of all, I have to apologize, like the lighting today, it is just so gray here, gray and cold, and no matter where I go, it's just not ideal. So we're going to push through. I want to talk today about looking for a surgeon. How do you find the right surgeon for whatever you're having done? So those of us in the business where I'm fortunate enough to have worked in operating rooms for over 30 years now, and we have sort of a relative bird's eye view where we see lots of different surgeons do lots of different procedures over a long period of time, and we sort of get a sense for who's doing things with relative ease, who's got what kind of complication rates, who handles the inevitable, things that come up with relative ease and that sort of thing. So I was trying to think about how I might translate that into some guidelines to help people who are not in that industry and don't have that kind of bird's eye view and help you figure out who might be a good surgeon for you. So first of all, I'm only talking about elective procedures. So elective means you have the benefit of some time to look at, obviously if you're brought into a trauma center in an ambulance or something, we all have to deal the hand we're dealt, to have to play the cards as well as we can. The good news is that when you're in some sort of an emergency situation, there's not a whole lot of variability from one provider to another, and things become, very rote and almost like an algorithm. I'm also not going to be talking about OB. If anybody wants me to cover that, that is a whole different topic, and I do have some tips in terms of looking for an OBGYN. You can put that in the comment box, and that would be like a whole separate video. And then I'm also not going to be talking about plastic, cosmetic, reconstructive surgery. That is its own field, and some of these tips that I'm going to tell you about might apply, but other ones wouldn't. And that's something I probably will do in the future in its own video as well. So what we're talking about is elective work. So like maybe your carpal tunnel release, or maybe you're going to have a joint replacement, or maybe you're going to have a gallbladder procedure, one that wasn't an emergency kind of thing, but you've decided you want to explore surgery for a problem. And then, how would you go about finding whoever gets to operate on you? It always impresses those of us in the field how a lot of people will spend, just hours going through Google reviews and volumes of consumer reports over buying a microwave. But when it comes to a surgeon, really the way people end up in this one's hands versus that one's hands is there's often a little bit of operating room humor that results from that. So here's what you might look for and who you might ask. And all of these suggestions sort of break down into those two categories: what kinds of things to look for and who you might ask. So as far as things to look for, the very first thing is real simple, and it is board certification. Your surgeon should be board certified in the specialty in which he's working. And I know he or she, yes, plenty of surgeons nowadays are women as well, but just for the sake of expediency, I'm probably going to say one or the other. Now, if you're going to be having surgery in a hospital, very often the issue of board certification is taken care of for you, just because many hospitals have bylaws, most of them have bylaws that require that people who operate there are board certified in their individual specialties. But a lot of ambulatory settings don't have those kinds of bylaws. Now, I'm not knocking the ambulatory setting. I actually love it, and I've spent most of my career in ambulatory surgery centers. I've done a video previously on some of the pros and cons of the ambulatory setting. But when it comes to going to an ambulatory setting, you are going to want to make sure that your surgeon is board certified. I have just found in my own experience that it is somewhat prognostic, and I think most of us in our field, in this field, would at a minimum look for that. The second thing is you'll want to compare. So if you don't have the kind of vantage point that I have, and there's no other way to compare people but to meet them. So you're going to want to get a second opinion, even a third opinion. Not that the opinions are going to vary that much, but it's the only thing that really allows you some basis for comparison. And I'm going to elaborate on that in a minute. So you're going to want to talk to 2 or 3 people, and 2 or 3 surgeons, that is. And here's the kinds of questions that you're going to want to ask when you see them. One is, how much volume do you do? So Most surgeries these days do lend themselves to a volume. Now, if you have some sort of a very rare condition, then I think all of this goes off the board, and I would just say you want to go to what's called a center of excellence, because if there's something that's really rare, you want to find the one or two people that at least see it more than most. So you want to go to a center of excellence for that, and that's not what we're talking about in this discussion. But volume really does matter when it comes to doing surgeries. It's not a guarantee, and not any one of these things alone that I'm talking about is a guarantee that you're going to get exactly the right fit. But as you go through this list of, well, board certification, volume, and the other things I'm going to talk about, you will start to form a consensus in your own head. There was an article that came out not too long ago in the Wall Street Journal, and somebody actually studied this, which seemed so basic to me, but they studied, surgeons who do higher volume versus lower volume, and they found what you would expect, which is that people who do something well usually do it a lot. So you will want to ask, and you should be hearing some numbers that it's more than average, more than most. Complications. So anytime you talk with a surgeon and you start discussing a particular surgery, usually that surgeon will launch into a list of the potential complications. It's part of the informed consent, so it's something they should be doing, and if they don't, that's also a problem. But usually they will, and you can ask, well, what about the complication rate? They often don't tell you that unless you ask, so you can say, what is the complication rate? What's the risk of that one thing? Okay, and there should be something measurable like a number. It might be a range. That surgeon might say, well, in the literature, depending on who you read, it's anywhere from, 1 to 2 per 10,000 or, whatever it might be. So the reason to do that is because then the next question you want to ask is, what is his complication rate? So that you have a basis for a comparison. And you're not really looking for somebody that's going to say zero. I mean, first of all, a zero complication rate is impossible. Anybody who tells you they have a zero complication rate, everything will be okay and don't worry about it, is probably lying. That would be a bigger concern. And more importantly, you want somebody who has been around the block a little bit and can handle a complication when it comes up. So what you're looking for when you compare the complication rate of this particular surgeon with the one in the literature is that the person that you want to choose, you want it to be somebody who has a complication rate who's at most, it's what it is across the board, and ideally it's a little better. So it's a little less, okay? It's a little less common to see that complication in his practice than the literature would be telling you. And then finally, when you're talking with this person about potential complications and how they might be handled, you want to get a sense that there's sort of a flow chart in his head. I don't know how else to say it. I was trying to come up with how to succinctly put this. You want to sort of see what sounds like it would fall into a flow chart if you were putting it on paper. So it might sound like, well, here's how we do this. We make the incision over here, and this is what we do, and then this is how this is done, and then afterwards you'll have like two weeks in a cast, or it should just be real straightforward. It should sound like a day at the office, and especially when you talk about the complications or something where there are choices. So it would sound like, well, if we have this happen, then what we do is we would do this, and then when that happens, here's the likelihood of a good outcome, or here's how we handle that. It should sound like this person is seasoned and the information more or less rolls off his tongue, is sort of the best way I can put that. And then why do you compare? Well, I've heard people say it's just too confusing for patients or people who aren't in this industry to get all this different information. It's just too confusing. And I beg to differ. I think these days, this is the information age. Most patients are pretty smart. They're educated. Plenty of them have pored over Google and done what they can. And I think, in my opinion and in my experience, the comparison, hearing things that are different from one surgeon to another, is the best tool for getting some clarity on what kinds of questions you might ask next. So, for example, there are some surgeries where they can do an incision in one place or another, and you'll go to one surgeon who will say, well, I do my incision over here, and another surgeon will say, well, I do my incision over there. Well, if you hadn't heard that, or if you hadn't gone to those two people and you didn't know that, you wouldn't have a basis to ask, well, why do you like this place versus that place. So all these things will help you hone in on what's going to be the best for you. Now, chances are, if there are choices like that involved, there are also trade-offs, and that's part of being your own advocate. You're going to decide which trade-offs you're willing to make, and you're going to decide which route you would rather go. I would say that I would steer clear of asking somebody to do something that's not in their comfort zone. So you wouldn't want to go to the surgeon who said, I make my incision, over right here by the collarbone, and you liked everything else about him and you kind of want to use him, but you want him to do that a different way. No, no, nothing good comes out of that. So you definitely want people working in their own comfort zone and doing what they do a lot and do well. So that's kind of the issue when it comes to what kinds of things to ask. Who to ask is another issue, and that one becomes a little harder for me to quantify, so I'm just going to try to qualify it a little bit. It does cause a few chuckles in the operating room sometimes when we hear about how somebody found this surgeon or that surgeon, especially if it's somebody that, we don't go to. I'm not going to get any flack for this when I get back to work. There's a certain minimum standard, and fortunately it's good. And most of the time, you can go to just about anybody who's a board certified, surgeon with some experience in any given area and probably get a good result. But we're talking about how to get the best. So the best we can do. I think that all you can do when it comes to trying to get a recommendation is try to get the recommendation from people who are more objective, and also try to get more of a short list than a one-name recommendation. Now, here's why I say that. Sometimes people come in and they feel that they've got a special connection with a particular person. They're so happy to be that person's patient because, they're in the same book club with his sister or something. And that stuff it might be fine, but overall, it doesn't tend to translate in reality into a real good choice in my experience. It's just as random as anything else. So I wouldn't be too motivated by who makes me feel really good or who gives me a cell phone number or anything like that. I think that kind of stuff can be a little misleading. Is it nice? Sure, it's nice to feel comfortable. Now, the kind of comfortable that's more important is that sixth sense that we have in our heads where after you've asked some questions, some things don't add up, or the person seems irritated with you, or they don't want to answer this question. They work around it. That kind of thing, when your antenna is telling you there's a problem, there's probably a problem. But the feeling in terms of, surgeons, I think, have a reputation of being temperamental. Well, any given field, there's an overrepresentation of this personality type or that personality type, and there are some really nice surgeons. There are some that are not so friendly to work with. Overall, I'd say a difficult temperament is probably somewhat overrepresented among surgeons, and I probably just wouldn't go to a surgeon's office looking for somebody who just made me feel good and warm and fuzzy. That's just not why I'm there, and I think it's better to not need that. So I would rather hone my recommendations and make sure that they're from people who are a little more objective. So if nurses who work in the operating rooms, anesthesia providers, of course I'm biased, but we're great at that. Even your primary doctor, particularly if your primary doctor has a very busy practice. If your primary doctor has one of these large busy practices, that means he or she is a good referral base, and they want to make sure their patients are very happy when they go to that particular surgeon, or they have the power to just use somebody else. And chances are the surgeon knows that. I would stay away from the friend recommendations. If I had to go that route, I would probably ask for a short list instead of asking for one particular name. And then I would take that short list and do that comparison shopping that we talked about earlier. So that's about all I have. I hope that you have enjoyed it. I hope that you'll ask some questions and leave me some comments in the comment box. I can't imagine this is going to be a controversial one at all when I get back to work. I hope that you'll consider subscribing, and please share with anybody that you think might be interested. And until next time, thanks for having me.